Assalamualaikum warahmatullahi wabarakatuh. We are from 3 with the title of Organophosphate Poisoning. I am Nur Anis Amira and I will be the first presenter. Okay, I'll start the presentation with the overview of the trigger. Next slide. The first trigger is about an unconscious 29 years old man was brought to the emergency department. He experienced headache, weakness, nausea, vomiting, diarrhea, and dizziness while at home. He then experienced urinary and fecal incontinence and lost consciousness on his way to the emergency department. The physical examination revealed that he had 8 pinpoint fractures, generalized paralysis, perspirations, and was unresponsive to the dripping. The corneal and jet reflex are absent. He also had profuse elevation, typhoresis, and excess lacrimation. He also had high blood pressure, normal body temperature, and normal pulse rate. Then the second trigger reveals that the patient just returned from a 5-day vacation at Teluk Cempedak. Earlier on the incident, the patient was missing pesticides for subsequent all palm trees spraying in their family orchard, and he became nauseated and started sweating profusely. Then people did notified that there was a spill in the chlorpyrifos formation on the floor and clothes. He took a bath strictly without thinking serious about it. Next slide. This is the contents of this presentation. The presentation will start next. First, start with what is organophosphate, followed by risk factors, signs and symptoms, pathophysiology, prevention, treatment, and lastly the long-term effects and conclusion. Next slide. So, okay, what is organophosphate? Organophosphates are chemical substances that are generally produced by the reaction of alcohols and phosphoric acid. There are a group of human-made chemicals that poison insects and mammals. They are the most widely used insecticides today. They can be used in agriculture, at home, gardens, as well as veterinary practice. Organophosphate insecticides are one type of pesticide that works by damaging the acetylcholinesterase enzyme. This enzyme is critical for controlling nerve signals in the body. The damage to this enzyme will kill pests and may cause unwanted side effects in the exposed human of toxicity and can cause similar symptoms to those who are exposed to it. Next slide. There are a few examples of organophosphates. You can start with chlorpyrifos, and this is what has been mentioned in the trigger. The other types include nerve gases, ophthalmic agents, antihelminthics, herbicides, and industrial chemicals. I think that's all for me. I'll pass to the next presenter.
Okay, my name is Nik Asma Madiha, and I'm going to present on the risk factor and signs and symptoms of the organophosphate poisoning. Next slide. So first, I'm going to present on the risk factor or people who are at risk for organophosphate poisoning. So we have people who live at or near an agricultural setting. So there's in 2019, there's actually this insecticide poisoning case happened at a chili farm at Port Dickson in Malaysia. It is known the result from this poisoning does not only affect the worker at the farm, but also experienced by the nearby school children. So at that time, it is considered as a quite dangerous case. So next, we have a person who worked at the farm. It is quite an obvious factor actually. So these workers at the farm are exposed to large quantities of organophosphate on the daily. So it actually becomes the management's management of the farm's duty to make sure that their workers are wearing the correct protection while working. And next, we have person who consume contaminated food or water. So in case you are wondering where the organophosphate infected food or water come from, it actually can come from the artesian well and food that come from orchard that uses a lot of organophosphate. So from this, we need to choose our food and water source carefully. And also, this reason may be why some people prefer to eat only the organic food. Okay, next slide. So at the next slide, we have the sign and symptoms of the organophosphate poisoning. Okay, so the signs and symptoms can be divided into 3 stages, which is the mild stages, moderate stages, and emergency stages. So for the mild stages, you can see the narrowed, pinpointed pupils, impaired and blurry vision, stinging eyes, runny nose, watery eyes, headache, muscle twitching, and agitation. So the usual stuff that are experienced by if you experience poisoning. Next, we have moderate sign and symptoms, which is very narrow pupils, dizziness, disorientation, coughing and wheezing, sneezing, difficulty breathing, muscle twitching, tremors, muscle weakness, fatigue, severe vomiting and diarrhea, involuntary urination, and defecation. So if you've noticed, in the moderate symptoms, the body actually started to excrete the liquids to protect itself from the poisoning. And lastly, on the emergency stages, we have very narrow pupils, confusion, agitation, convulsion, excessive body secretion, and all that stuff. So these emergency symptoms are actually a signs that the poisoning starting to get really serious, and we believe that the men in the trigger are experiencing the moderate symptoms, but quickly moving on to the emergency symptoms as he is brought to the emergency department. So it is a good thing that he is brought to the hospital immediately for further treatment. Okay, so that's all from me. Please welcome the next presenter.
Assalamualaikum warahmatullahi wabarakatuh. My name is Najah Fatika Kamrudin, and I will continue with.
Sorry, it's my turn. Okay. Bismillah. My name is Nur Akila binti Ismail, and I will continue with the pathophysiology of organophosphate poisoning. Next slide. Okay, everyone can see the slide.
Yes.
This is the pathophysiology of organophosphate poisoning. The first one is organophosphate insecticides are readily absorbed and distributed in the body through skin and mucous membrane by inhalation. They are also readily absorbed by injection and also skin absorption. So as they are readily absorbed by injection and as they are readily absorbed, they can cause rapid onset of the symptoms. So in the body, organophosphates will inhibit the acetylcholinesterase in the nerve tissue, which then will cause the accumulation of acetylcholine at the synaptic area of the nerve. This is due to the property of the organophosphates, which are the acetylcholinesterase inhibitors, and they form irreversible covalent bond to the enzyme. And acetylcholinesterase is an enzyme responsible for degradation of neurotransmitter acetylcholine, which is found in both central and peripheral nervous system. So when a person ingests the organophosphate insecticides, it will phosphorylate the serine hydroxyl group of the acetylcholine, thereby reducing the serine hydroxyl group of acetylcholinesterase. So it will reduce the ability of the enzyme to break down the acetylcholine. So it will, the accumulation of acetylcholine at the synaptic area will cause the overstimulation of the cholinergic nerve system, which will then lead to the symptoms mentioned before by Madiha. So as can be seen in the picture below, the green column shows the normal condition of the acetylcholine signaling at the synapse, while the yellow one shows the action of enzyme acetylcholinesterase that stop the signaling by degrading the acetylcholine following stimulation, while the red one shows that the effect of organophosphate injection that inhibit the action of acetylcholinesterase, which cause the accumulation of acetylcholine at the synaptic area. So, and the picture above illustrates the action of organophosphate at the synaptic area of the nerve. I think that's all from me. I'll pass to the next presenter.
My name is Najah binti Kamaluddin and I will continue with prevention and treatment. Next slide. Okay, for prevention, the first organophosphate should be correctly stored and well labeled to avoid intentional contact. And second, wear protective gear during and after applying pesticide containing organophosphate to the crops. And protective gear should include covering the head and neck, wearing a mask or respirator, and using eye protection. And third, anyone working with organophosphate should wash before eating, drinking, smoking, and urinating. And always take a thorough bath or shower at the end of the workday. Next slide. 4. Any exposure to organophosphate should be washed off immediately with water and a mild alkaline soap. And avoid using detergents as they may increase the absorption by removing the skin's protective oil. And number 5, staying indoors with windows shut during application of organophosphate may help to limit the exposure. And lastly, wash all the fruits and vegetables to prevent accidental exposure from contaminated food. Okay. And next slide. For treatment, as with many poisoning and chemical exposure cases, the first step is stabilizing the person being treated. So emergency workers will often first decontaminate the body to prevent further exposure. And second, stabilize the breathing so that the breathing patterns will return to the normal one. And lastly, they will remove the toxin by using intravenous IV fluids. Okay, in order to remove the toxins from the blood and also the body. Okay, that's all from me. I pass to the next presenter.
I am Nur Nadia, and I will continue the presentation with the next part, that is long-term effect and the conclusion. So, the long-term effects are effects that are caused by poisoning or the treatment that is used, and it may continue for months or years. So, first is the neurological problems, such as muscle weakness, poor concentration, poor memory, and post-traumatic stress disorder. And the second is the fertility problems that may cause the infertility or reduce the fertility, like the endometriosis, polycystic ovarian syndrome, ovulation problems, and also the poor egg or the sperm quality. Also, the organophosphate poisoning may cause other diseases like hyperglycemia, diabetic ketoacidosis, pancreatitis, and also cancer. For the conclusions, with all things considered, it is concluded that the men mentioned in the trigger were suffering from the organophosphate poisoning from occupational exposure. So generally, thousands of cases of organophosphate are reported yearly involving the agricultural workers, with more frequency in areas where there is limited access to insecticide safety gears. Thus, it is important for the workers and also the employers to practice the occupational safety and health to help prevent the incidents and reduce the risk of the exposure.
Lastly, from an Islamic perspective, in verse 195 of Surah Al-Baqarah say, "And spend in the way of Allah, and do not throw yourself with your own hands into destruction by refraining, and do good. Indeed, Allah loves the doer of goods." This verse depicts that Islam is not only stressed on the safety aspect, but also focused on to evade men from hazard or unsafe acts. And in a hadith narrated by Sahih al-Bukhari, Prophet Muhammad SAW has been reported to have said, "The companions of Allah Apostle used to practice manual labor, So their sweat used to smell and they were advised to take bath. This saying depicts that being concerned on one cleanliness is the indication of safety and health. Both safety and health are important factors that ensure employees to be able to contribute the best quality of works and services to the organization. Islam encouraged the practice of occupational safety and health as they are better than curing an illness. And that brings us to the end. Thank you.